Okay, well, this is me, and I live in New Jersey, and I work for the Division of Human Services, and I specialize in dysphagia, and I implement and do dysphagia workshops for individuals with developmental disabilities. However, my heart lies in the world of aphasia. For my doctoral program, which I just completed last year in 2019, my focus was thinking of ways of how to advocate and support people with aphasia, people who have had stroke, and their caregivers. The main focus was how, to look at what's available in New Jersey in terms of supports that are culture specific. And the results of the research that I got, encouraged me to create a SLP guide, a resource guide for other SLPs to use so that they can get to know more about the South Asian culture. It's never, you can never talk about aphasia and the definition. You can repeat it all the time, and it's so necessary because so many people still don't know about aphasia. And I think a lot of people got some great points in all the presentations that I've seen that for some reason there's a lack of awareness. So I always feel like even though there's a lot of people on here that may know what aphasia is, I still like to include it in every presentation that I do because it's so important. The word needs to get out there. So just a quick recap, aphasia is a language disorder that is a result of damage to part of the brain that is responsible for language. It can be caused suddenly as a result from stroke or a head injury, or slowly from a brain tumor or other neurological diseases. Just by looking at the numbers over here, it's striking to see how the high incidence of it. I mean, every 4 minutes, someone dies from a stroke. So, and it's one of the leading causes of adult disability in the US. So who are South Asians in the community? This is important to know because a lot of time, many speech therapists or many other health professionals may or may not know exactly just from meeting or looking or talking to someone where exactly someone's from or what their cultural preferences are. Sometimes because India is such a large country in South Asia, a lot of people, regardless from wherever they are, they may just be considered, oh, they're Indian. But no, they might be Afghanistani, they might be Nepali, they might be from Bhutan or Pakistani. So it's very important to really know the differences. So I just wanted everyone to take a quick look at who are the South Asians in the American community. So I live in New Jersey and I am South Asian. My parents are from India. And what I wanted to do was combine, well, maybe I'll get to that a little bit later, but let's talk about New Jersey. South Asians in New Jersey are an earnest group of people who arrived here with hopes of living the American dream. They work hard, and many have done well for themselves. They bring along their traditions and unique beliefs and are open to sharing their culture with other New Jerseyans. This is a map of New Jersey, and I know it's not very clear, but if you see the pie chart, all the blue areas are where Asian Indians reside. And that census was from 2010. And it would be very interesting to see what the numbers look like in 2020, because going back from the last decade, 2000 to 2010, the number of Indians, Pakistanis, Bangladeshis, and Sri Lankans, they increased significantly by 57%. That is a whole lot. So there are a lot of South Asians in a densely populated state like New Jersey. So with the increased population, there's going to be increased needs for healthcare. Compared to other communities, South Asians are unfortunately at a higher risk of having a stroke, perhaps because of their higher incidence in high blood pressure, diabetes, and possibly their diet, because there's a lot of foods that are high in saturated fats. So one of the questions I asked myself in my research are there effective culture-specific supports for South Asians in New Jersey with aphasia? There are plenty of resources for people with aphasia in New Jersey, but are there any that are culture specific to South Asians? So the long and short of it is there are no, not that I'm aware of, and please let me know if there are, but there are no South Asian support groups or resources for, they are, let me just clarify this. They are South Asian support groups, but they are for sexually assaulted victims, for domestic violence. I believe there's something for Parkinson's or mental health, but there's nothing specific for aphasia. So that concerns me because there's a large number of South Asians, and there's a gap in where their needs are met. I had a chance to observe some of the aphasia groups at Adler Aphasia Center, at JFK Medical Center, and spoke to some folks at Lingraphica. And from the information that I got, that there's nothing specific to South Asians. They do have some groups for Hispanic Americans or Spanish speaking folks, but nothing for South Asians. So what's the impact of the problem? As I said, it increases the gap of people not receiving services with the continued lack of awareness, education, and accessibility to culture-specific resources. And we have to, as speech therapists, we should be evaluating best practices so that we're culturally competent and able to meet these people's needs who are at a high risk for getting stroke. Sorry, just got something in my throat. Cultural competence, that is a huge part. It's like a buzzword. And ASHA, which is the American Speech and Hearing Association, requires every audiologist and speech language pathologist to practice in a manner that considers each patient's or client's culture, their family, cultural, and linguistic characteristics, because that is all encompassing. And really, when you start treating someone, diagnosing them, assessing them, or have them on your caseload, providing a more unique and personalized treatment is what's preferred, and overall would be a better service delivery model. Going back, so much so that ASHA also provides tools to speech language pathologists that basically is like a checklist, like, you know, how culturally competent are you? If you're working with someone from a different culture, are you aware of what their needs are? Do you know what you could say that may or may not offend them? So these are things that we all have to keep in mind, and it's our responsibility as professionals to make sure that we know what another culture may or may not prefer when it comes to certain things. It affects a lot of parts of the interactions. Brock and Fraser have some solutions to increasing cultural competency. Some of them are, of course, providing interpreter services. If you don't understand the language, if you're speaking to someone from South Asia, of course, an interpreter is necessary. However, a lot gets lost in translation when that happens. You can recruit and retain minority staff. Maybe there's someone who understands the language, or maybe someone who appreciates or understands the small nuances that take place in a clinical setting. Number 3, I just made it large because that's the one that I chose to kind of tackle at. You know, what I did with my resource guide, which I'm going to talk about in a bit, is I wanted to provide training to increase cultural awareness, knowledge, and skills in the form of a resource guide. Because if I want to share my information, how do I create like a training model? And then there's some other very good suggestions here by Brock and Fraser in order to, you know, increase cultural competency. So it made me think, what can I do? What can I do to be part of a solution? What vision do I have for aphasia rehabilitation going forward? And how can I contribute to change? There's a billion ideas that go on in my head, but sometimes I get a little stuck. But I'm like, what can I do that's meaningful to me, that I can use, and that's personal, and that I can, you know, what gap can I fill? So as I said, I'm South Asian, I live in New Jersey, and there's obviously a gap with the number of people receiving strokes with the kind of services that are available specifically for them when it comes to being culture specific. So I thought, let me see what I can do about that. With the thematic analysis that I done, the most areas that were a topic to where cultural considerations would matter were family, gender roles, marriage, languages, stereotypes, religion. These are big areas that differentiate not only South Asians from other communities, but also between themselves, because there's 8 countries and all of them have a little bit of their thing. For example, family. South Asians have a collectivistic culture in which they generally put their family's interest above their own. Families' responsibilities tend to hold a greater importance than personal needs. So it wouldn't be surprising or alarming if you as a speech therapist go into a room and you greet them. It's important because family is so big and they're respected. You would want to greet everybody in the room. Doesn't matter if there's mom, dad, grandma, brother, sister. The family is like one unit when it comes to healthcare and making decisions. So even though you're talking to the patient who has a stroke or may have aphasia, it wouldn't be alarming if the mom asks the dad or the dad calls the uncle, because it's really a unified decisions. That is one of the examples. In terms of gender roles, generally gender roles in South Asia are more patriarchal and rigidly defined than in the United States. Back home, men are viewed as the main income earners, while women are seen as the homemakers. In New Jersey, the dynamics between South Asian couples more or less match the mainstream couples concept of both husband and wife heading the household. South Asian women here use their independence and freedom to make choices for themselves and areas of education, career, marriage, etc. I mean, this also happens back home, but I'm just talking about the general concept. So another example of gender roles might be if a female patient with stroke would prefer working with a female speech therapist because of how gender roles are considered and how comfortable they are with that. Marriage, languages. Okay, let's talk about languages. There are a lot of languages in South Asia. In each country, they may speak up to like 3 to 10 languages in each country. It is it's a lot, but it's also what makes them very unique and very specific with how they communicate. Language can also be considered verbal and nonverbal. In terms of verbal, a lot of times in speech therapy assessments, a lot of times, people are asked to point to a pant or a shirt, shoes, generic clothing. But wouldn't it be nice if if they were talking to someone who only wore a sari, so to be able to identify with clothing as saris, or a kara, which is a bangle that some Sikhs wear. So those kind of things really like personalize speech therapy services. And nonverbal language. So nonverbal language could be like gestural, like for example, like a head nod. A lot of times South Asians tend to say, answer this way. So if I'm asking a South Asian person, do you want some coffee? And if they said no, they would probably go no like this. That's familiar, right? No. However, if they want to say yes, they may go like this. Now that head nod is a yes. In South Asia, everyone pretty much gets that. Even in New Jersey, if you're talking to South Asians between each other, they know this means yes. But that can be very confusing for someone who doesn't understand that, because if I had to ask someone, do you want some coffee? And they go like this, I would probably think, I'm like, maybe, maybe not. But it's a direct yes. So small things like that make a big difference if you understand if someone's basically, responding yes or no. And a lot of times people with stroke are not able to speak, maybe at the beginning, or their speech is affected. So if they're not able to communicate and they're going like this, and you think it's a maybe, but really it's a yes, it can be quite frustrating. So those are some examples. So this is a little snippet of the resource guide that I created. It is this is the table of contents, and I go into detail with each country, and I talk about religion, ethnicities, spoken languages, readings, communication styles, social, professional, religious etiquette, and a quick do's and don'ts. So this way anyone can just get the book, open it, and kind of be like, oh, okay, oh, I don't want to do that. This may make them feel better. How can I personalize the speech delivery service? One of the examples for greetings, avoid greeting someone from South Asia with a hug or a kiss unless you really know the person well. They may not prefer to be touched. Etiquette, just some examples. if you have, group therapy, and if you're passing something along, whether it's food or a pen or something, try to use both hands or your right hand, because the left hand is known to clean yourself after you soil yourself, and the left hand is considered dirty. So these are small things that make a big difference. And if as a speech therapist or any other health professional understands and is aware of these, it makes the world of a difference to people. And there's many more examples, but for the sake of time, I'm going to keep this going. But basically, it's an ongoing process. It's almost impossible to know everything about every culture, but the hope is that if the approach is taken with increasing knowledge about various cultures, understanding the quick do's and don'ts, not falling into like, okay, stereotyping people into, oh, they're like this or they're like that, getting to better know them would make a world of a difference. And obviously, I want to mention the differences such as generation, level of acculturation, citizenship, refugee status, circumstances of immigration. There's so much that goes into it. So, although there's so much information about how different they are, they're also very similar, but it really depends on other factors. What's next? So what do I plan to do with it? I'm here. I'm at Aphasia Access doing the teaching, and it's been an honor. This was a great opportunity for me to share a little bit about what I have created, and I hope that it's useful to health professionals. And it's almost complete, and if anyone is interested in it, just shoot me an email. So once I'm completely done, and hopefully I get to publish it soon, I'll let you know when it's available. So what do I plan to do? I want to share the guide. I've been thinking about starting a support group for South Asians in New Jersey, because there definitely is a gap, and provide culture-specific therapy using telepractice, perhaps. Also, with COVID going on and people at home, accessibility may be not an issue, because caregivers are at home right now with their family member with stroke. Also, I've connected with some stroke and aphasia groups in India, and there's a website there for if there's anyone in India who wants to get more information. They're amazing, and it excites me to know that they're doing a lot more about it. And they also are trying to advocate for increasing the awareness. Once you know about it, then maybe you can do more. I could reach out to the hospitals in New Jersey to provide staff training, and I don't know, I guess it's endless. I just want to see if I can make a difference with this guide and help fellow SLPs and professionals understand the South Asian community in New Jersey better. Thank you.